So I think I'm going to start. Let's see if some people will join later on. So hi everybody and welcome to today's session. I'm very excited about the topic today. As I've already said, before I start, please scan the QR code. This is for us to basically get to know your expectations and improve this, because today's session on recruitment of underrepresented and vulnerable participants is part of the Cycles of Care workshop series, where we have the chance as a group to basically look into parts of the academic research. So the first time we looked into why sex and gender specific factors are important to consider in research, but also in practice. And today we're going to speak about the recruitment of underrepresented and vulnerable populations. So while today's example are more focused on academia, I also strongly believe that it helps you if you're a product designer or product management, because you always have to decide whose voice is going to be heard and who's not. So reflecting on that might be valuable anyhow. So today I would love to quickly introduce our team. So we have a lot of people here who are making this work, so thanks a lot to all of you. We have Nimera, we have Xenia, who is not here with us today, we have Lavini, we have Marcia and me. Most of us are PhD students. Marcia is our lovely professor, so she's supporting this work, but also there are a lot of people who are not on this list who supported us to come to this place, so big thanks to them. We also have a very interesting keynote speakers today. We have Daniele Vitara, we have Nimra, and we have Abdel. Unfortunately, Daniele Vitara needed to cancel today's keynote because she got unfortunately sick. So we are very, very pleased and very, very thankful that Nimra will take her place in short notice. So please keep in mind, we are trying to make our best here today. So thanks a lot, Nimra, for this very spontaneous action from your side. But we are also very excited to have Abdel, who traveled to Switzerland, to Zurich, from the Netherlands, to speak about why underrepresented and vulnerable populations should be included and how we can do this. So what we're going to do today, we have a little bit of an intro and a welcome session, which I will take over. Then we're going to jump into the keynote of Nimra, and you can ask questions. And then we're going to do the keynote of Abdel, following a short break where you can enjoy the lovely apero. I heard the strawberries are very nice. And then we're going to have an interactive workshop where basically the idea is that we include what you've learned into practice. So it's really about using what we've learned in an example workshop, and that we have the time to interact with each other and use the knowledge there. If you have not signed up for the workshop, please don't hesitate to just come too, because I feel like today we have enough space for everybody to learn. So feel free to just stay, and later on we're gonna do an apero and a little bit of a networking and chit-chat session. Good. We're gonna record all of the keynotes, so they will be made available for you later on. We will have a discussion with Daniele on what works for her the best. She will record her keynote later on. Manage that she will also contribute to a later session of our Cycles of Care event. So we'll need to figure out how we're going to do this. But for sure, today, Nina and Abdel will be recorded, so you can also jump into that later on. We're going to do pictures, or Marcia is going to do pictures. If you don't want to be on the pictures, please come up with one of us and tell us that you don't want to be in the pictures, so we can make sure that we will not be in the pictures on social media. So I have the honor to do a little bit of an intro session for today. And I was very inspired by Marcia's last introduction from the last session, where she took a little bit more personal approach on the topic. And I was thinking, okay, let's try to do something similar. Let's try to make a little bit more personal introduction to the topic. So including vulnerable and underrepresented participants is very important for me, not only on a personal level, but also on a research level. So I try to bring today both kind of perspective into this little intro. So one very important phase in everybody's life is childhood and adolescence. A lot of things are changing with your body during this time. Your body is changing, your hormones are fluctuating. You need to kind of figure out who you are as a person, what is your opinion, and how do you see the world. So you're kind of very vulnerable in this situation. And this time can also have a big influence on how you see the world and how you see topics. For me, for example, I can still remember the first time I got this period. I didn't really know what this was. I didn't know what is happening with my body, how everything is changing. And I didn't really know what the cycle is. So I really trusted the people around me, Akka, my mother, and for example, the gynecologist. And I then went to the first gynecologist appointment and asked about the different contraception. They showed me different ones, but the way they spoke about certain contraception, it was basically clear that there is only one viable option. I mean, who am I? I don't really know anything to question his opinion. So I went with that option and didn't really ask any questions because I was not really confident. Years later, I saw that I had severe side effects of this contraception, and I was very angry. I didn't really understand how it can be that I was not informed, that I didn't feel comfortable to speak up. I was angry on myself. And at this point, I didn't really understand that this was not about me, but this was kind of the system I was in that moment. I mean, yes, I didn't speak up, but also this person or like the system didn't invite me to speak up, and I wasn't asked to ask my question and have the space to ask these questions. But for sure, I'm not the only one having this experience. Today, I'm in a very different space. I am doing research with children and adolescents in menstrual health technology, so I can use this experience now. And when I first looked into the topic, I thought there was like a common understanding, like not everybody, but most people have a common understanding that we need to look into menstrual health technology from a more life course approach. So we need to think about the different transitions, which can have an influence on how you understand something later on. But when I looked actually at the study, a lot of them just start at 18 and plus. So why is this? Because I do believe that it's the default to start with 18 and plus, and it takes a lot of ethical consideration and time and care to also include the younger ones. However, by doing so, we exclude systematically the people who are shaping the first experience, which can have a big influence later on. While I do understand that not every study can include everybody, I really think that we need to have a shift from thinking about, okay, per default, nobody's included. We need to think who will be included, to think about who is excluded and why are those people excluded. So if we then consider including those people, we as a researcher have a lot of responsibility in thinking about how do we create those spaces for the people. For me, when working with children and adolescents, it's my responsibility to create spaces where they can share information. This means, for example, create different mediums where they can share things. For example, not just speaking. Some of them like to speak, but some might prefer to draw. Some prefer to show something. This, for example, is one picture of our study. You see it's very messy, but we have different mediums for them to show what they want to say. On the other side, we need to create safe spaces where they feel comfortable to share their experience and find the trust to do so. And yes, I do see that it takes a lot of time and it takes a lot of care, but I do feel that it will make the end product or research a lot better if you take the time to do so. And even if you do a lot of, or if you include a lot of time and care into the study setup or the product setup, and you really want to hear about them and give them the space to speak, you can still be, and I do have this also in my projects, that people say, I don't want to speak with a random person about menstruation. And this is also part of working with vulnerable participants. There are a lot of underlying issues such as stigma, assumption, and bias, which we may not see at first, which can have an effect on its